I'm Marlene Winfield, and I'm from NHS Connecting for Health, and I'm the Director for Patients and Public. I've been involved in Y Touring's Breathing Country project. Well, I was asked, and I was curious, and I thought it was a clever idea, and it was about a topic I was really interested in. Well, I was involved pretty much from the beginning in everything from the early briefings. I was on the advisory committee. I was a member of the audience several times, and I actually participated in some of the question and answer sessions. I really enjoyed it. I thought it was such a clever process. I was fascinated by seeing how you put a play together. And I got to spend a lot of time with teenagers who had some very interesting things to say that I needed to hear. I thought it was a really good project. I thought they got the play just right because it raised a number of issues in ways that sort of twisted and turned and took you were thinking one thing and then you were thinking another thing. And so it really did stimulate debate very well. It raises the whole issue of electronic health records, of using information for research, of consent, of privacy, and also of the really interesting debate about, an important debate about public good versus private interest. They're really important issues, and it's important to have a debate about them because they are going to impact everyone in the future. And I was very taken by what one of the young people said in one of the workshops that contributed to the play, who really had a sense we are making decisions now, not only for us but for the people who are going to follow us, who are going to have these electronic records throughout their lives. So it's important that we really get these things right. And one of the best ways to do that is to hear all the different views and try to reach the most workable compromises. And this play helps us do that. I think the theatre of debate approach does something really important. If you'd gone out to a group of young people and said, we want to talk to you about electronic health records, they probably all would have been asleep by the time you got through the next sentence. This way of doing it really engages them and takes them through the issues in a really easy to understand way and gets them thinking. And I was very taken by a review in eHealth Insider by one of the young journalists from eHealth Insider who went to the play and said, I never expected to go to a play about electronic health records and come out crying. And so, I think it was a really clever and engaging way of stimulating a debate, and all the things that went on around it, the voting that went on around it, and the structured debate, I think really must help people frame their thoughts and get to grips with something that they do have to think about in future but wouldn't have thought about otherwise at this stage. I learned a lot through being part of this process. I learned a lot about how you put a play together. I learned a lot about what young people are thinking now about some of the issues that are very important in my work. I learned about the power of the theatre of debate as a way of engaging people. And while I was learning all these things, I had a wonderful time. Well, in my area of health, some of the future issues are going to be people getting access to their own records and managing their own health using their health records. And just the whole thing about seizing the control, moving from an NHS which is quite paternalistic to one where there's joint decision making, and how we prepare people for that joint decision making, what their feelings are about it, because they're used to an NHS that is paternalistic, and in some ways it's going to be hard to leave that behind. Another big area that's arising is freeing up data and looking at making raw data from the NHS available to others, and how you do that effectively and safely in a way that gives people the kind of information out of that they want, and how you take this wealth of information that's going to be available and process it into ways that are useful for people. I think why touring is a clever, inventive, resourceful way of using theatre of debate to involve people in debates that are going to be, are going to be even more important for them in the future.